Hello, everybody.
Hello.
Hello, Bernard.
Yes.
Yes,
Hi, Irene.
I recognize your office anywhere.
Hi, everybody.
Michelle, sounds like Michelle.
That's me.
That's you. There you are. Hello. I think we're just gonna wait a minute or two. Well, the organizers upload something. Okay.
Leonard, when you want.
Okay. Are you ready?
Yes.
Ready? Oh, sorry. Right. Okay.
Ready.
Okay. So welcome everyone to today's international seminar series on liver toxicity and steatotic liver disease. So this is part of our EASL-DILI consortium series, where this is EASL endorsed event and brought together with Holt Ronan and mainly the Holt Ronan consortium on drug-induced and herbal-induced liver injury, and we're hoping to develop, well, through seminars and collaborations, possible, future funding for this area. So I'd like to introduce, and a great pleasure in introducing Professor Inbal Mor. She, just a bit of background how this invitation came about. I was in, well, we were in Groningen at the European Club for Liver Cell Biology, which sounds like, a sort of holiday camp, but it's not really. It's a biennial conference on liver cell biology, and I'd highly recommend it. I think the next one is in Spain, so keep an eye out for that. So we had a good chat on, our Holt Ronan project and the human in vitro models we're developing, spheroids and liver chips and multi-omics approaches, and we found mutual interests and possible collaborations in the future. So, Inbal is currently at Technion University in Israel, and she received her PhD from the Hebrew University and worked in Glasgow at the Beatson Institute, which have been to world-renowned Beatson, with Professor Gottlieb, I believe, who gave a talk in Edinburgh. It was very interesting on general metabolomics and liver disease. So her research has been on cancer biology, so hence the Beatson Institute, and now she's shifted her focus to MASLD axis and looking at drug-induced liver injury, and particularly in the context of MASLD and chronic liver disease, and uses metabolomics approaches. So, and has recently published a very nice paper in Cell Metabolism. So she's going to give a talk, which will begin very shortly, on the effect of metabolic changes and hepatic steatosis on drug toxicity. So I'll hand the reins over to Inbal. Welcome again, and I'll open the floor to you.
Thank you, Lenny. It was really a nice meeting, and we really got chatting. And the work I'll present was done at the Technion. You're absolutely right, but I've now moved to open my own lab at Ariel University. So that's where I'm localized now, just recently. So thank you very much for inviting me, and I look forward to sharing our findings and discussing them with you, all of you here. Can you see the slide? Everything is in order?
Yes.
Yes, perfect.
Yes,
Great.
good.
So we can move on. Okay, so this is my general opening slide to convince people that MASLD is super important and it's a global health issue, but I think this crowd doesn't require this introduction. The prevalence of this disease has been growing ever since it's been identified decades ago. There hasn't been a year since where it's been slowing down. And therefore, a third of the global population is estimated to have MASLD. It's gonna become the leading cause of end-stage liver disease and the most frequent indication for liver transplantation by the end of this decade. So definitely worth studying. And this is a progressive disease. Start out with a healthy liver, progress into simple steatosis that's characterized by lipid accumulation. This stage can be maintained for many years, but it's a risk factor to progressing into later stages of the disease where inflammation is involved, leading to tissue damage and fibrosis. And this can then progress again in a small proportion of the patients to end stages such as cirrhosis or hepatocellular carcinoma. The early stages, wait, I'll get my pointer. The early stages of simple steatosis are absolutely reversible if the patient can adhere to the doctor's recommendation for adopting a healthy lifestyle, a healthy diet, exercise, and so forth. Losing weight will make this go away. And this stage of simple steatosis is, I think, considered by the medical community to be clinically benign. It's a risk factor for progressing into the later stages, but in itself, it's not considered much of an issue. Looking at this disease from a mechanistic point of view, I think the former name that it had until 2 years ago, fatty liver disease, non-alcoholic fatty liver disease, kind of meant that it did what it said on the tin. There's accumulation of lipids. That's the cornerstone of MASLD is accumulation of lipids. So we see them in the histological analysis as lipid droplets in the liver, and this can later also lead to inflammation with MASH, hepatic steatotic steatosis. So the fact that there's more lipids in the tissue means that the balance between processes that generate the lipid, the de novo lipogenesis, or the lipid uptake from the diet is increased compared to ways of eliminating the lipids either by secretion through VLDLs or through breaking them down, oxidizing the lipids to beta oxidation. So there's a shift in the energy balance. So even though this early stage where lipids are accumulated is completely reversible, clinically benign, it's obviously very different. The cells in this stage are obviously very different from the way hepatocytes look in a healthy tissue. And we, as people who study metabolism, were curious to understand what would be the metabolic changes that characterize the early stage of MASLD, where it's reversible, where it could inform us about progression into later stages. So in order to do this, we used the Western diet preclinical model where the mice receive a diet that is high in sugar and sucrose, high in lipids. It also contains cholesterol, and they're very happy to consume it. And this progresses very quickly into liver steatosis. We see an increase in body weight even after this. This is a 12-week model, but the body weight gain begins much earlier. We see an increase in liver weight and also parameters that kind of tell us that the tissue is affected, that the liver is affected, an increase in circulating liver enzyme, increase in circulating cholesterol. The gross morphology shows a typical fatty liver, steatotic liver. It's larger, it has this paler color, and histological analysis confirms that. We see the steatosis, the macrosteatosis, and staining with all red O for neutral lipids showed us that there is increase in triglyceride levels in the liver. So we didn't see markers of inflammation. There's no inflammation at this stage, but there's definitely steatosis. So now, okay, so what are the metabolic changes in this very early stage of MASLD? For this, we did what's called an untargeted metabolomic analysis. Untargeted meaning that we're not looking for any specific set of metabolites, but it's not unbiased because the way the protocol goes, the methodology goes, the way we extract the metabolites, the way they are run by the LCMS determines what are the chemical properties of the compounds that we can detect. So we did a polar extraction. So polar compounds would exclude any of the lipids that I mentioned before, the triglyceride, the cholesterol, any other complex lipids like phospholipids, ceramides, but it would definitely cover a very large variety of metabolic pathways like glycolysis, TCA cycle, amino acid pathways, nucleotides, and so forth. So we won't be able to see the changes in lipids, but maybe that's slightly less interesting because obviously the tissue of the Western diet-fed mice has a different lipid profile than the chow diet-fed mice. What about the other pathways, the polar metabolites? So doing a principal component analysis of the chromatographic features that we were able to identify showed us that the two populations are indeed different, both in the liver and in the plasma. So we do have different metabolism in between the healthy mice and the steatotic mice. And when we were able to identify about 300 compounds, to annotate 300 compounds in both tissues, 350 in the liver, 270 in the plasma. And from those, about 100 compounds showed statistical significant difference between Western diet and chow diet. So we did a pathway enrichment analysis on those metabolites that were statistically different, significantly different. And for both tissues, both the liver and the plasma, we saw that the top ranking pathways that were enriched had to do with the glycine metabolism. So you see serine and glycine metabolism, methionine metabolism, another amino acid. Betaine is another derivative of glycine. So there was a high representation of pathways that were relevant for glycine metabolism. And then we did a targeted analysis. So we specifically looked at glycine and we could show that it was lower both in the liver and in the plasma in Western diet-fed mice compared to the healthy mice. And actually, if you look through the literature, there's quite abundant evidence that not only lipids change, but amino acids change. In most cases that are discussed, it's an increase in branched-chain amino acid, but there's also consistent reports of a decrease in glycine levels, both in other preclinical models, not only the Western diet model for liver steatosis, and also in patients with mast cell or other relevant metabolic diseases such as the metabolic syndrome and cardiovascular disease, atherosclerosis. They show lower circulating levels of glycine, and it's correlated with disease severity. So this is not, well, it's consistently reported, it's not easy to explain because glycine is a non-essential amino acid, meaning our cells should be quite capable at producing more glycine. And it's definitely not a change just from a change in the diet, because protein will get glycine from proteins that we consume. And that definitely couldn't explain the difference between the chow diet and the Western diet fed mice, that changes in dietary glycine. So we were, again, looking at the world from a metabolism perspective. We were quite intrigued by the fact that glycine is reported to be decreased, and wanted to understand the mechanism behind that. So changes, when we try to understand what changes could lead to levels of decrease in levels of glycine, we need to consider the different metabolic pathways that it participates in. So there are metabolic pathways that can produce glycine, and the main pathway for that is a branching from glycolysis. That's what I teach the student in the basic biochemistry course, about how amino acids are synthesized de novo. So from glycolysis with serine as an intermediate, there's an enzyme called SHMT that synthesizes glycine. Glycine can also be produced from other precursors as well, but serine is definitely the main one. A change in glycine levels could also be the result of changes in pathways that consume glycine, where glycine is the precursor. Serine is also the product of glycine because the SHMT reaction is reversible. So theoretically, glycine can be converted into serine, and this way lead to a decrease. And again, there are other pathways that use up glycine. So when we looked at downstream metabolites of glycine, we saw that all of them were basically decreased or unchanged. So that could simply be explained by a decrease in the availability of glycine itself, leading to a decrease in its downstream metabolites. The one that stood out was serine, right? And we said that serine can also be a precursor or for glycine or a product of glycine. So serine levels were elevated in the Western diet livers compared to the chow diet. So is this what's consuming glycine? Is this the cause for the decrease in glycine levels? More serine synthesis? In order to understand if the changes in serine synthesis from glycine, we gave the chow diet and Western diet fed mice, we injected them with carbon-13 labeled glycine and sacrificed them after 1 hour. So we can trace the carbons, the labeled carbons of glycine, and see if they end up in serine, right? So glycine theoretically could be converted into serine. So when you do this isotope tracing with glycine, so here looking at glycine in the plasma, injecting the mice with glycine obviously led to an increase in circulating glycine. This is a really short-term experiment. So you see that the baseline levels are low as we detected before. And now most of the glycine is labeled. What's more interesting is to see where those carbons go. And we could find them in the serine. So the labeled glycine was incorporated into serine, and there was a higher level of serine synthesized de novo from glycine in the mast cell mice. meaning that there was reverse SHMT activity. And not only was more serine synthesized from glycine, but the labeling pattern of serine could also kind of inform us about glycine metabolism in the liver. So you see here that glycine can contribute 2 carbons into serine, right? Serine has 3 carbons and glycine has 2. The 3rd carbon of serine can also come from glycine. There's another pathway in the mitochondria, the glycine cleavage system, that cleaves glycine and takes one of its carbon and loads it. It's also substrated for SHMT, loads it into the serine. This would generate serine that has 3 labeled carbons, or serine that has just 1 labeled carbon if the 2 carbons came from unlabeled glycine. And we could see those isotopologues in the liver from the Western diet, and also in the plasma from the Western diet fed mice. It's not just the carbon counting. This means that not only is more glycine consumed in order to make more serine, but that 2 units are in this pathway, 2 units of glycine are used in order to make 1 unit of serine. So that would even enhance the glycine consumption. And when we do the math and calculate how many units of glycine are used to make serine, so the glycine-derived serine, we see that the difference between the Western diet and the chow diet fed mice becomes even more pronounced. So the rate of serine synthesis is increased, and more units of glycine are used to make that serine. So we wanted to test whether the serine synthesis from glycine is the cause for the decreased glycine levels we measured. Okay, so the theory is nice, but now we have to test it. And for that, we treated the mice just before we gave them the label glycine. We treated them with an SHMT inhibitor. Okay, so no serine conversion from glycine. And now we're only looking at Western diet fed mice, only muscled mice, either with the vehicle or with the inhibitor. So the inhibition of SHMT completely abolished incorporation of the glycine labeled carbon into serine. It worked. And we see that both in the liver and in the plasma. The consequence of that is that glycine levels were now elevated in the mice that had SHMT inhibition. So when we stop SHMT activity, when we stop serine synthesis from glycine, levels of glycine in the plasma and in the liver are increased, supporting the theory that the increased serine synthesis is the reason behind the glycine depletion in fatty liver. So if that story seemed a little complicated, I actually oversimplified it because there are 2 SHMT isoforms, one in the cytosol, SHMT1, and one in the mitochondria. And both enzymes catalyze the same interconversion between glycine and serine. But because they're found in different cellular compartments, the reaction substrate product can participate in different pathways. So in order to understand which of the isoform is responsible for depleting glycine, we collaborated with Professor Oren Rom from LSU, Louisiana State University. And their group has mice that have SHMT2 knockout and only in the liver. Okay, so SHMT1 is functional, SHMT2 is functional in all the other extra hepatic tissue. And in these mice, they're all on Western diet, but we can compare the wild type mice to the SHMT2 knockout mice. And we see that knocking out SHMT in the liver elevates glycine in the liver and also in the plasma compared to the wild type mice. And again, the serine to glycine ratio is now reversed. So when you knock out the SHMT2 in the liver, the serine to glycine ratio drops in the liver and in the plasma as well. So it's probably the glycine-derived serine is synthesized by SHMT2, and it's this isoform in the liver, the reverse SHMT activity in the liver consumes glycine, leading to this characteristic decrease in glycine in metabolic diseases. So in my view, we've just pushed the question one step further down the pathway. We've moved it to why, from asking what's the mechanism behind glycine decrease to why is serine synthesized more in fatty liver? What is the fate of this glycine-derived serine in fatty liver? So we looked for those labeled carbons in many pathways that serine participates in. It's also, again, participates in different pathways. And the one which is relevant for us now is that serine is the precursor for sphingolipid metabolism. The first step of sphingolipids is condensing serine with palmitate. And then this backbone can undergo many, many modifications to generate the plethora of all the sphingolipids that function. It's a whole world that I'm not that familiar with. But what was interesting to us is that it's widely reported that not only the profile of sphingolipid changes as mast cell progresses, but also the level. Okay, they become more pro-inflammatory. Obviously, the signaling they convey changes, but overall their level of this family of lipids also increases in mast cell. And they've been implicated in the development and driving the negative effects of fatty liver. So is this where serine goes? For that, we looked at the labeled carbons that are now found on serine. We've seen that already, to check if they're present on sphingonin, which is one of the early stages of sphingolipid metabolism. So it's really the very early stage before all the different modifications are performed. So it's a common precursor. And we could see again that in Western diet livers, there's higher levels of sphingonin synthesized with this labeled serine, and also looking at the ratio, the proportion that the labeled sphingonin out of the total sphingonin in the tissue is also increased. So elevated sphingonin metabolism consumes this serine. And when we blocked SHMT activity with the inhibitor, we could see that we couldn't see this labeling. So that experiment was only an hour long, so it's not the right time scale to see changes in overall levels of sphingonin. But we could definitely see that inhibiting the conversion of glycine into serine also meant that there was no labeling in the sphingolipids, in sphingonin specifically. That's what we looked at. So we think the fate of this serine is to make other lipid types, and this consumes glycine, and this is behind the cause for the decrease in glycine availability. So, okay, so this is the mechanism. What would be the consequence of this low glycine availability in steatotic livers? So, if you remember from the earlier slide of downstream metabolites, where glycine is the precursor, glutathione was really on top of the list after serine, because it's a major glycine consumer. Glutathione is a tripeptide made up from 3 amino acids. So glycine is one, cysteine and glutamate are the other. And we could see that glutathione levels are also decreased in the Western diet-fed mice, and no difference in the other 2 amino acids that make it up. Okay, so only glycine, I've already showed you that it's lower, cysteine and glutamate, and basically all the other amino acids were not altered. So glutathione is a major antioxidant. Oxidative stress is has a central role in disease progression. It has this SH group that can react with reactive oxygen species or other free radicals and neutralize them. And we see that mice with Western diet show lower glutathione levels. So we wanted to next understand what would be the consequences of this low glutathione in the steatotic hepatocytes, right? This is mice with very early stage disease. So for that, to understand what could be the effect of glutathione, we turned into paracetamol hepatotoxicity. So paracetamol is what we call it in Europe, in Israel as well. The same compound on the other side of the Atlantic is called acetaminophen, or APAP for short, and I'll use this annotation in the next slides. So I think we all know paracetamol, very common over-the-counter drug, very effective analgesic, antipyretic. And because it's so common, it's also a big problem for drug toxicity. In the right doses, it's very safe, but an acetaminophen overdose is a major cause for acute liver injury and acute liver failure, and indication for liver transplantation because of acute liver failure. The way it's metabolized in the liver is that almost all of it is metabolized through phase 2 reactions. It's neutralized by addition of glucocornide or sulfate, and these are non-toxic metabolites that are then excreted by the kidney. A small proportion of acetaminophen is converted into a very reactive free radical, NAPKI. But luckily, we have an agent that deals with free radicals, and that is glutathione. So it's neutralized immediately by glutathione. And again, we see derivatives of the glutathione NAPKI adducts in the circulation and in the urine. We see the NAPKI conjugated to cysteine that comes from the cysteine and glutathione, and we can find it in the urine. The problem with an overdose is that it results in a higher, just absolute levels of higher levels of the NAPKI. And this depletes the glutathione. There's not enough glutathione around to neutralize it. And then we have this very reactive free radical ravaging the tissue, reacting with lipids, with the mitochondria, with the membranes, leading to cell death and tissue damage that could sometimes be irreversible. And the standard of care for people who come in with a paracetamol overdose is to give them N-acetylcysteine, which is a way of providing the liver with more cysteine to support de novo glutathione synthesis and eliminate the SNAPkey. So this has to be provided in the early hours, up to, I don't know, 5 hours after the overdose, when the damage, when NAPkey is present, and it can't help at later stages when cells are already damaged. So how is that relevant to fatty liver disease? So there's actually very limited real clinical data, even though it's really extensively studied. But when you look at good data about the effect of NAFLD on acetaminophen toxicity, most reports quote this study from about 20 years ago. It's from 2008. It was a huge retrospective study in the United States. And they came up with a number of 7-fold higher prevalence of acute liver injury in patients that had NAFLD, as it was called at the time, and compared to patients with an acetamine overdose that did not have NAFLD. But there's some downsides to this study, is that, and the authors comment on it, is that the patients that came in with an overdose did not go through any workup, any medical examination to determine if they have fatty liver. It had to be registered already in their file for that. And the way the authors did the analysis is that they looked at the codes that the hospitals put in to determine if that patient had NAFLD. So there has to be some underrepresentation of patients with fatty liver, because if they did not have a prior diagnosis for this, then there's no way of knowing. They didn't undergo any additional tests. They were treated for the overdose, did not undergo any additional tests to determine their liver health in any way. And the authors themselves comment on the fact that the prevalence of NAFLD in this huge cohort, you see the numbers, was extremely low, much lower than expected by the demographics of the patients. So it was only 0.1% of the patients were diagnosed with NAFLD. So I'm sure these patients, if there's any underrepresentation of any stage of the disease, it has to be of the much earlier stages where maybe they weren't even diagnosed with that. So I definitely don't think it covers early stages of steatosis. So we wanted to use our model to ask if the decrease in glutathione in MASLD affects APAP toxicity. Makes sense, but we need to check that. We started out with a much simpler model in order to kind of answer this question, and these are the AML12 cells. It's a non-transformed hepatocyte cell line. You can load them with lipids. Here it's palmitate. And then we did metabolomic analysis on them. So definitely, if you give them palmitate, they have higher intracellular palmitate. But what was also nice to see is they recapitulate the phenotype that we saw in the liver, in that they have lower glycine and lower glutathione. And when we looked at the oxidative stress induced by acetaminophen, we see that here the cells are stained with THE for superoxide. And you can see that treating them either with APAP or with palmitate increases oxidative stress, and treating them with both agents led to even higher oxidative stress. And this was also could be seen by an effect on cell viability. So definitely the cells with palmitate were more sensitive to acetaminophen than cells that were treated with acetaminophen alone and experienced higher oxidative stress. Back to our mice. We gave the mice a dose of 300 milligram per kilogram, and it is an overdose, but it's not a dramatic overdose. We could see that, and we picked this dose because we could see that the healthy mice could tolerate it very well. It's about comparable to human doses. It's about twice the maximum single dose recommended, so not an extreme overdose. And the mice were sacrificed at 24 hours past the APAP administration. When we looked at liver enzymes, you can see that even for the chow diet fed mice, there was a huge increase in liver enzymes. So it is an overdose and it is toxic. The hospital lab was actually quite angry with us because they had to undergo to do lots of serial dilutions in order to work with this serum sample, plasma samples, because they saturated their ELISA kit. And then the Western diet fed mice showed even higher, extremely high liver enzyme, indicating that they experience higher toxicity in the liver. And we could see that when we looked at the liver. So these are the cell line treated. So the Western diet fed mice, as I said before, have larger liver. They're paler because they're fatty. And after the APAP administration, 24 hours after that, we could see that the livers looked red again, but not because they're healthy, but because of the hemorrhaging in the liver, which we could also see through histological analysis and grading. So yes, it looked like a APAP overdose was more toxic to the mice with liver steatosis. Okay, so what about metabolism? We traced or we measured glutathione levels at different time points. So they start out with lower glutathione, as we mentioned earlier. At 3 hours, for both groups, glutathione levels were almost undetectable, rock bottom. And then they start to recover. And we can see that the Western diet fed mice recover less, and at any time point that was measured, their glutathione levels were lower. They also experience more oxidative stress. We can analyze that by calculating the ratio of oxidized to reduced glutathione. So higher oxidative stress in the Western diet fed mice. A higher oxidative stress also could be measured through the activation of the NRF2 transcription factor. So we looked at downstream genes for NRF2 and could see increased activity, indicating, again, higher oxidative stress. So is glycine the issue here? So there's low glutathione, but is it because of the low glycine? In other works that we've done, we were able to show that administering glycine to cells, nothing to do with steatosis, supports de novo synthesis of glutathione, either in the AML12 or in bone marrow-derived macrophages. So will glycine administration support mitigate the oxidative stress? In the AML cells treated with both acetaminophen and palmitate, treating them with glycine or with glutathione improved oxidative stress. So that's a good, kind of makes you feel good about glycine role in this issue. And in the mice, we treated the mice with glycine immediately after administering the acetaminophen, and also at the 3-hour time point where glutathione levels were at their lowest. And now, this is only in the Western diet fed mice. So you can see glycine levels in the liver were much higher in mice that received acetaminophen and glycine. What's more important is that they also show higher glutathione levels compared to the Western diet mice that only received acetaminophen. So glycine supported glutathione synthesis, and we can also see that because when some of the mice received the labeled glycine, the carbon-13 labeled glycine, and we could see those carbons now incorporated into glutathione. So yes, the glycine supported de novo synthesis of glutathione. And it also mitigated the oxidative stress because mice treated with glycine showed lower GSSG to GSH ratio, and it could also show lower levels of glutathione H&E, which is a marker of lipid peroxidation. So oxidative stress on the lipids leads to release of glutathione H&E. So yes, those mice showed lower oxidative stress and higher glutathione. For anyone curious why we got this very complex labeling pattern in glutathione with the glycine and not only 2 carbons labeled, it's because the glycine feeds into serine synthesis, which contributes to cysteine synthesis. So all these carbons can then be incorporated. Glycine plus cysteine, different combination, gives us a very complex labeling of the glutathione. I'll be happy to discuss that if anyone's interested. What is the outcome for the mice? Bottom line, we see that treating the mice with glycine led to lower levels of circulating liver enzymes. Now, if you look at the livers, they went back to being pale because the hemorrhaging was lower. The histological score was improved, and the survival rate for the mice on Western diet that received glycine was comparable now to mice with the healthy mice with the chow diet. And I think we can see that. Okay. Let's move play. Okay. So these are the chow diet mice with acetaminophen. You can see they tolerate this overdose very well 24 hours later. These are the Western diet mice 24 hours after the APAP overdose. They're very poorly, not happy at all. And these are the Western diet fed mice that received acetaminophen and glycine. Much more active, feeling much better compared. So glycine administration definitely attenuated the APAP toxicity in the mice with liver steatosis. So to conclude, we showed that mice with the liver steatosis display a decrease in glycine levels, and this is due to serine synthesis through reverse SHMT2 activities. And the consequence of the low glycine is that there's lower glutathione levels and lower ability to synthesize de novo glutathione when it's consumed by acetaminophen. And this supplementing the mice with glycine elevated the available glycine and supported de novo glutathione synthesis, protecting the mice from acetaminophen toxicity. So there's a kind of a balance between glutathione levels, tissue damage, and available glycine. So if you make glycine available, you can support de novo synthesis and decrease tissue damage. And if I want to make more general comments, I think it's worth monitoring circulating glycine levels in patients. To determine, because that could infer about their ability of the liver to deal with drug toxicity. And an even more general statement that I want to make is that we see that the metabolic changes that occur even early on in MASLD, even when it's probably not diagnosed and definitely not considered to be a medical issue, does have this stage of the disease does have clinical implications, because it means the patients could be less capable in neutralizing xenobiotics in the liver. So this work, as Lenny said before, was published last year in Cell Metabolism. And it was obviously a joint endeavors by different institutions. And most of the work was done at the Technion by my PhD student, Alia Graev. It couldn't have been achieved without the very intense collaboration with Professor Eugene Chen in the University of Michigan and Professor Oren Rom at Louisiana State University. And now I've moved to establish my own lab at Ariel University, and we're making, progressing with the questions that arise from this previous project. So the lab is actively recruiting. If anyone here thinks of doing a postdoc or a PhD is interested in changes in liver metabolism and how that could be involved in identifying new therapeutic targets and understanding drug toxicity and glycine metabolism, I'd be very happy to discuss that. It's one of my favorite conversation topics. So I want to thank all of you for your time and attention. I'll be happy to answer any questions.
Thank you. Thank you, Inbal. That was an excellent talk. Thank you very much. Very clear indeed. This business of MASLD DILI has been perplexing, issue for quite a few years now, and this really illuminates a very important aspect of it, I think. I've got a question or two, but Bernard, I thought he might raise his hand. Here we are.
Yes.
So, yes, Bernard?
Are you hearing me?
Yes.
Yeah.
Okay. Yes, thank you very much for your talk. It was very interesting. Actually, I read the paper as already he was published, and I was very excited because we also study the toxicity of acetaminophen in MASLD, and we didn't look at serine and glycine metabolism, but we and other had some experiments and some data showing, strongly suggesting that higher cytochrome P452E1 activity might also be involved in the higher toxicity of acetaminophen in the context of MASLD. And I read the paper and I looked for any data regarding CYP2E1, and I didn't find it. And I wonder whether you had such data in your pocket, either for the mice model or for the IML12 model.
Yeah, you're absolutely Yeah, you're hit the
One
nail on the
question.
head. Yeah, because CYP2E1, right, is the one that catalyzes the
NAVQI.
NAVQI. Yeah, so
the NAVQI.
it also raises the question if people that consume alcohol that leads to an increase in CYP2E1 would be more sensitive. So we weren't. We did some Western blots, so we didn't look too clearly at those. We couldn't see any dramatic changes in total protein levels, not in the cells and not so much in the mice, maybe a little in the mice, but not too dramatic. I don't know if the timeline was not appropriate. I don't know at which time points, because we didn't try all the time points. We kind of did some exploratory study and didn't get beautiful results and kind of left it aside. So you're absolutely right. I think it's really hard to get conclusive data about CYP2E1, but we can't avoid it. We have to look at the activity levels and how that changes, and it might need more profiling, because I think if there's a general question about drug metabolism, then we have to think about cytochrome P450 system and how that changes.
And just also one remark and one question, because I mean, to be honest, when I looked to many papers regarding MASLD and CYP2E1, although a majority of article and data are in keeping with increased CYP2E1 activity and expression, is not all the study.
Yes.
And so, I mean, my question is regarding also glycine. Glycine is decreased in your model of Western diet feeding, but I wonder whether you test other high fat diet enriched, for example, with cholesterol or other type of diet, to see if it is reproducible along with other MASLD diet.
So we tested another diet. The reviewers actually asked for that, and
it was not me.
It must be like the obvious question. So first I can say it's not because glycine is low in the diet. So that would have been, not a very interesting story. We also looked at another diet that we started out with and left aside because it wasn't that great in inducing muscle. It only gave us microsteatosis and not really nice macrosteatosis. It was high in fat and glucose. It had maltodextrin in it. But we already saw the low glycine. So that's why we pursued it for a while and kind of set it aside and didn't progress with it for the acetaminophen studies. So I do think there's really something there with glycine in particular, and it's not just because of the type of diet. And the fact that we also see it in patients that are on very varied diets all over the world tells me kind of that it's a correct characteristic of the pathogenesis, and it's an early marker.
Okay, thank you for these comments and
it's really
answers.
interesting. I'd be happy to discuss the acetaminophen.
Thank you.
Yasmin?
Hi, good evening. Thank you for the perfect presentation. I have a question. We were working on fructose in diet, and there are some literature saying that fatty acid, obese people, in fact, and diabetic people has low serum level of branched chain amino acids and high serum level of aromatic amino acids. And we were exploring whether fructose has something to do with this. And we have found some interesting things that confirms your findings. So my question is that the decrease in glycine level, might it be related with the fructose content of the diet, or do you think it's a primary issue related to change in metabolism in obese people or diabetic people?
So From the data that I have, it's not enough to give you an answer because the Western diet has sucrose, which is 1-to-1 ratio glucose and fructose, so definitely much higher fructose. Branched-chain amino acids, as far as I remember, are commonly reported to be elevated, and they're also they're essential amino acids, so they do have to come from the diet. I think it's a primary effect because, as I said, we see it in patients and not just patients who consume carbohydrate-rich diet. But the mouse data, it would not be suitable to answer that because the Western diet has higher fructose. And we know from other researchers that the reverse SHMTA activity is actually typical to the liver. There was another paper published back to back with us that had nothing to do with liver steatosis, but just looked at serine glycine metabolism, whole body serine glycine metabolism, and the consumption of glycine by the liver in order to make serine is a regulator of whole body glycine levels. And what we showed is that it's increased in steatosis. So I think it's primary to the changes in the tissue.
Thank you, Yasmin. And Inbal, any other questions to the floor?
Yeah,
There's
me
Bernard
again.
again.
Yeah, me again. Yeah. Actually, you mentioned, or I mean, you show a slide where the DT109 product, a compound was mentioned, and I wonder whether you test this compound besides glycine alone to see if DT109 was more efficient in your model to restore glycine and to alleviate the acetaminophen toxicity.
So yeah, so Eugene Chen that we're collaborating with, their lab is producing this glycine-derived compound that's doing very well in other models in atherosclerosis, and they're testing it. We didn't do it. It's in my research proposal, so hopefully I'll get around to actually doing it. But they showed really nice results with DT109, and it's probably better tolerated than just glycine.
And is it available at Sigma, or can we buy it?
I don't know, but I'm very happy to ask.
Okay.
He's really looking for people to expand the applicability of DT109. So I don't think there'll be any issue if they have enough compound available. I'll be very happy to connect.
Okay. Thanks.
Thanks. Just a quick question for me. Regarding the glycine levels in patient, I think you mentioned some data, but have you looked at a much larger cohort and to determine if this could be a kind of a recognized bona fide biomarker, maybe glycine and glycine serine ratio or something like that?
So I'm quoting the literature here. We didn't do this exploratory research to check it as a biomarker, but I think it's worth exploring. If you look at the body of evidence and the data, sometimes people outright say that glycine is low. Sometimes you have to kind of sift through the data that's there, and then you see that glycine is low, but it's very consistent. So I don't know, technically speaking, how easy it would be to develop a test, but a lot of assays are now done by metabolomic analysis. It won't be the first one. So I'm sure there's a way of making it cost effective.
And in terms of potential therapeutics, have you thought of doing maybe a combination therapy like NAC, NEC with glycine or something like that in your test systems?
It could be interesting because NAC is really well tolerated. It's the standard of care. for acetaminophen, but it won't address the low glycine availability. So maybe, yeah, that's an interesting thought. Combining the old and the new to.
Yes.
Yeah, I think it's really interesting.
Okay. I think we're a bit over time, but that's for a good reason. Very interesting discussion. Thank you again, Inbal. I look forward to chatting with you in the near future, and anyone else, I guess,
Yeah,
in Bernard, you
very
should
happy.
sort of connect up. We should link in, and we'll keep in touch.
Great.
Thank you very much
It's been
indeed.
a pleasure. Thank you.
Great.
Bye bye.
Thank you.